Welcome to Dr. Harshman's Medical Cost Control. My name is Emil, and I'm a guest speaker at this segment. I'm very much interested in the problem of medical cost control because it affects all of us. It's been ballooning. We don't seem to have any clear-cut plan that everybody agrees upon that will attack this problem. And the problem grows like Jack and the Beanstalk. About 10 years ago, the annual cost was about $600 billion. That's billion with a B. And today, it's increased by 50% over the last 10 years. And it's today about $900 billion a year and growing. Now, I thought that perhaps a simple case study of my own experience as a medical consumer might be of some interest or might be of some value. Now, 35 years ago, I came down with a severe case of diabetes. And at that time, my blood sugar was about 400. The last reading I had, now mind you, this is after 33 years, the blood sugar was 115. And I thought perhaps a short biography might be of some interest in terms of how this kind of control has been achieved over a period of over 33 years. Now, recently, in fact, last week, the New York Times had a brief summary of an article by Dr. Dean Ornish in California in terms of his treatment for heart therapies. And the kinds of things that he suggests for heart therapies, I think, apply to a wide range occurs to a wide range of medical conditions, and I think this new understanding is likely to be of a great value, not only in terms of the quality of lifestyle, but also in terms of problems of cost control. Incidentally, I spoke about blood glucose levels. Normal glucose levels for healthy people numbers should range somewhere between 80 and 120. So, and the consequences of a very high blood sugar level can cause blindness, amputation of legs, heart disease, kidney trouble, a variety of other things, and of course, I would say early incapacity and severe death. Now, let me read briefly this article that appeared in the New York Times on August the 1st. It's about a new insurance for the treatment of heart diseases. Now, last week, I'm reading from the New York Times, Mutual of Omaha the nation's largest provider of health insurance for individuals, announced it would reimburse patients participating in a program that combines diet, meditation, exercise, and support groups to reverse heart disease. The quote-unquote reversal program, developed by Dr. Dean Ornish, director of the Preventive Medical Research Institute in Sausalito, California, is the first non-surgical, non-pharmaceutical heart disease therapy to qualify for reimbursement. It will probably not be the last. Such therapies could help relieve chronic illnesses like back pain, repetitive stress syndrome, and arthritis, said Dr. Joe Jacobs of the NIH, the federal NIH in Bethesda, Maryland. Dr. Ornish has documented clinical trials of his program for 17 years. His patients eat a vegetarian diet that derives only 10% of its calories from fat, practice yoga, exercise moderately, and participate in support groups. The result is an 82% overall reversal of coronary artery disease in the first year. Let me read that again. The result is an 82% overall reversal of coronary artery disease in the first year, he said. The reversal plan also costs $3,500 yearly, about 1/10 that of conventional therapies. Although initially skeptical of a plan that employed lifestyle intervention rather than surgery or drugs, the medical community applauded the insurer's decision. Following the announcement, 3 major medical centers, Emmanuel Medical Center in Omaha, Beth Israel in New York, and Griffin Hospital of Yale University, announced plans to open reversal centers in the fall. Now, this new program, and I'm saying new in quotation marks, is pretty much the program that I have followed for 33 years and accounts, I think, for the general good health that I've experienced despite this underlying medical condition. Now, let me summarize again that what this program emphasizes in Dr. Ornish's program. In other words, there was a triad: diet, exercise, control of stress, which involved, of course, interrelationships with friends and family. Now, Dr. Ornish spoke about the fact that he limited his patients' daily intake to 10% of their calories were in fat. Now, what that meant was that he relied primarily on a diet of vegetables, nuts, seeds, but also included fish and meat as condiments for the vegetables. Now, is this an adequate diet? Well, it's not only an adequate diet, it allows one a wide choice of nutrients And it is not a boring or tasteless diet. It is a diet that one can enjoy very, very greatly. Now, following that diet, my weight has come down from 227 35 years ago to about 140 today. And that's without any medication, but simply eating as liberally of these foods as one was able to. It also meant avoiding junk foods and eating a diet in which every calorie of nutrition counted. So you avoided, in this case, soft drinks, diet or otherwise. You avoided sweeteners of any kind. And I have found this diet to be a highly enjoyable one, so that I think I enjoy food today more than I have at any time in the past. Now, what does this include? All the green vegetables, kale, spinach, string beans, cabbage, carrots, fish of all kinds. Of course, one could eat liberally of fowl without the skin. Now, this diet also presupposed, a general feeling of well-being also proposes a program of exercise. And what I suggest is that one walk 30, 40, 50, 60 minutes a day or more. And if one is not accustomed to walking, one should walk short distances first, get conditioned, and after a while include and after one walks a while, one could extend the distances one walks, and one could walk at greater speeds too, up to the point of fatigue. Now, there are a variety of other exercises that one should do. For example, since back pain is very frequently a medical problem that affects so many people, and especially as people get older, one should do a number of exercises specifically to strengthen the back. And I would suggest that one get hold of a book by Leon Root, paperback, called Oh My Aching Back, which gives a series of exercises that would strengthen one's back and would act as a preventive measure for back problems as one gets older. Now, in all of this, there are three words that one should bear in mind, and the three words are primarily prevention, prevention, and prevention. Now, my endorsement of my suggestion of the Leon Root book, I don't know Dr. Root, and I'm mentioning that because I think that's the easiest way to get hold of the exercises which are explicitly suggested, or the implementation or the use or how to do these exercises is given with great specificity in this book. So now, I said the prevention are the important things, and prevention. Now, this, of course, I just want to make clear that my reference to Dr. Root's book is not a paid endorsement, and if he hears this or sees this, he'll be very much surprised to hear this, but I have used the book so well, and since it's been so much a part of my own personal program, that I think it's important. I recommend that book to all of my friends. Now, in fact, if this were a different format, I would demonstrate the exercises, which take about 20 minutes to do, and I do them every morning. Now, in addition to walking, a number of other exercises I do. For example, I climb stairs, and although I'm in my 80s, I climb 50 flights of stairs every day. I'm not suggesting that anybody now go out and climb 50 flights of stairs tomorrow, but I think that it'd be very, very helpful to use your body. And I said walk when you can instead of riding. For example, if you're going to go to the subway, if you can walk one station, introduce more walking in that. When you, I suggest walking stairs if possible, rather than climbing, rather than using the elevator. Now, all of this is postulated around a program of prevention. The diet I suggested will not only provide adequate nutrition, but will also prevent obesity. And obesity is really a disease condition, and which is a high risk factor in a variety of disorders, such as the heart therapies that Dr. Ornish is now talking about, diabetes, arthritis, possibly even various forms of cancer. And of course, when I speak about my own reduction of weight from 227 now to about 137, this has been achieved mainly by this kind of diet, which doesn't involve any sense of deprivation. And I think the control of obesity and having a diet that enhances the quality of life, so that when you sit down to eat, you look forward to what you're going to eat, you relish what you eat, and you think about your meal with great mental satisfaction. And I am sure that this mental satisfaction will be enhanced by the bodily satisfaction that you feel after this kind of diet. Now, it also involves quantities of food. I think that one should eat a wide variety of these foods, but also in relatively small quantities. Now, I have spoken about diet, obesity, and exercise. Now, the third part of this triad is the control of stress. And we are becoming more and more aware that stress is a killer. And stress inhibits the body's immune functions and makes one susceptible to disease. The stories that Norman Cousins told about laughter and the optimistic attitudes that he felt that had been that were critical factors in his recovery from very, very severe illnesses that had been considered almost incurable. Now, I think the sense of we take about 26,000 breaths a day, and I think that we should try to make each one of these breaths one that is accompanied by a state of happiness and a state of well-being. Now, Dr. Ornish suggested meditation, and this is one way in which one can reduce stress that raises blood pressure, that increases cortisol levels in the blood, and predisposes one to illnesses and makes recovery from illness more difficult. And once again, I want to mention another publication, not a paid announcement, by Dr. Herbert Benson of Harvard University, who wrote a very important book called The Relaxation Response, in which he demonstrated techniques that would enable one to reduce stress levels. That's also a paperback, and I say that the title of the book is The Relaxation Response. Never met Dr. Benson, don't know him, but I've used the book to my great advantage, and I've recommended it to my friends. Now, also, I think it's important to maintain a personally optimistic attitude about the quality of one's life, one's ability to overcome illnesses. And I think a part of that is feeling joy in doing what you can do to make those who are near and dear to you and others happier. And even for those whom you don't know, if you feel there are things you can do that will benefit other people, and you do those things, and you do those things happily with a smile, these things that may benefit other people, that you do because you think they may benefit other people, turn out in the final analysis to benefit you most of all, and to add to your sense of personal well-being. Now, what has this to do with medical costs? I think if we do the things that add to our personal quality of life, we incidentally will be doing something to cut down medical costs. And once again, the key to all of this is prevention, which revolves around diet, exercise, lifestyle, the avoidance of stress, and the feeling that, like the lilies of the field, we are well provided for. Now, I would also suggest, since I have 2 or 3 more minutes, that one might also, when one does these exercises that I've referred to, that one pay attention to one's posture, to walk with your head up, your shoulders back, because most of the back difficulties, most of them, are postural in origin. And I think would also help in terms of relaxation to try a little breathing exercise, and that is by breathing abdominally. In other words, protruding your abdomen and then inhaling deeply and holding the breath for a count of 6 and exhaling slowly to a count of 4. I think if one does that 2 or 3 times a day, one will also feel a sense of well-being and relaxation. Now, each of these subjects that I've spoken about, diet, exercise, stress reduction, one's positive relationship with other people. Each of these subjects would require a program in itself. But I think the 2 books I've suggested would be good first elementary introductions to these publications. Now, I'd be very happy to answer any questions that you might have. God bless you. Now that a time has come, as General MacArthur said, old soldiers never die, and for me as for him, the time has come to fade away.
For a free public access program guide of all the shows on public access, send a self-addressed stamped envelope, 2 stamps to 29 and a 23, that's 52 cents postage, to Access Manhattan Magazine, Department EJH, Box 319, Gracie Station, New York, New York, 10028. Please specify if you want Paragons or Manhattan Cable's schedule. It's free.